Hello viewer, you're welcome to Health Issues with Dr. Paul Ungu. So in this particular series, we are going to be looking at quite a number of things on prostate cancer. First of all, we are going to start with looking at the difference between prostate cancer and benign prostatic hyperplasia, which is one thing that people tend to confuse. So I want to say that not all prostate diseases are the same. So the basic prostate diseases, prostate cancer is there, benign prostatic hyperplasia, which is the ordinarily enlarged prostate. That one is there. You have prostatitis, which could be chronic or acute. So, but the ones that people usually confuse prostate cancer with BPH or benign prostatic hyperplasia. But I want to clarify some things in terms of difference between prostate cancer and benign prostatic hyperplasia. So, like the name sound, prostate cancer has to do with a cancerous prostate. Benign prostatic hyperplasia has to do with just a prostate that is just enlarged, ordinarily enlarged. The reason why it's good to know the differences is because their treatments vary. Number one, the issue of PSA. For somebody with prostate cancer, PSA becomes very, very important. When we say that the PSA is high, the import or the significance is that we will start considering whether somebody has prostate cancer or not. For people with benign prostatic hyperplasia, PSA is usually normal. The normal PSA range is 0 to 4. But when PSA starts rising above 4, we'll start suspecting prostate cancer. Once it's more than 10, the suspicion for prostate cancer becomes very, very high. In terms of the size of the prostate, there's nothing much as per prostate cancer, because no matter the size of a prostate, if the prostate is cancerous, the prostate has got cancer, prostate is cancerous, it does not change anything. Where the issue of size, most times comes in, is when you're talking about benign prostatic hyperplasia. So you now check the normal prostate size now was 20 to 25, but as people keep on increasing in age, their prostate also keeps on increasing in size. You can go and do a scan and you're told that your prostate size is 40. You can do another scan some years later and you're now told that your prostate size is 45, 50, 60. So the size keeps on increasing. The import of that is that as the size increases, you will now discover that most times the symptoms that has got to do with an enlarged prostate starts manifesting. Because as the size is increasing, the tendency that the prostate will now start compressing the middle part, the channel through which urine passes, becomes higher and higher. And that is why you now start having symptoms. What are these symptoms? We have things like poor stream, the urine does not flow very well. You have things like frequency, you need to visit the convenience multiple times. You have things like urgency, if you feel like urinating and if you don't go immediately, it be as if the urine is coming out on its own. You have things like you're having to wake up multiple times at night to urinate. You have things like intermittency, where the urine stream stops, straining, where you have to strain or push for the urine to flow out. These things starts coming up. But for prostate cancer, it is discovered that in early prostate cancer, you don't have symptoms. I want to say it again. In early prostate cancer, you don't have symptoms. Unlike in BPH or benign prostatic hyperplasia, where you start having symptoms from the onset. So for prostate cancer, once you start having symptoms, once you start seeing things, most signs, the prostate cancer has really advanced. So it's good for us to know the differences between these two things. And most times when we are asking patients to go and do a PSA, the reason we are asking you to go and do your PSA or do your PSA yearly or every 2 years at most is so that we will know when there are signs that prostate cancer is developing. But for benign prostatic hyperplasia, the symptoms can be there. Once when you have the symptoms there, if we examine you, if we send you for investigations, we'll get to find out. But for prostate cancer, symptoms are not usually there until late. Thank you for listening and for watching. Please, you can go ahead and share this video and watch out for our subsequent episodes. Thank you.
Dr. Paul Ungu is a urologic surgeon who is passionate about sharing his rich knowledge to improve your understanding of medical procedures and optimal health. With years of experience from intricate laser surgery techniques to essential endoscopic procedures, prostate health guidance, gynecological care, men's health, and etc. Dr. Paul's YouTube channel covers a vast range of medical enlightenment. By watching our tutorials, you'll gain in-depth understanding of medical procedures, insights into the latest technologies and techniques in use, confidence in your healthcare decisions, access to expert advice from a trusted specialist. Enhance your knowledge today by subscribing to this YouTube channel, Dr. P.E. Ngu. Hit the subscribe button now. Join our community of healthcare professionals and individuals to learn more. Be accurate with the latest in medical knowledge. Click the notification bell to stay updated on our new tutorials, as page access is completely free. Dr. Paul Ngu, empowering your medical knowledge one tutorial at a time.